We're ready when you are, Justin.
Great, thank you. Welcome, colleagues. My name's Dr. Justin Varney. I'm the Director of Public Health for Birmingham City Council, and I'm delighted to welcome you to the first webinar in the series to support the rolling out of the Be Healthy campaign across Birmingham. This is very much a partnership approach, and we're really grateful for the support that you're bringing to making this something which jumps off the paper into people's lives and really will make a difference in terms of reducing deaths and serious illness from coronavirus as the situation continues, but also help support more of our citizens to live healthier lives, which will be in general benefit to them, their families, and the wider communities and the cities. I'm only with you for a short period today, as you can understand, with the current COVID situation. I'm having to jump between meetings. But I'll take you through the first couple of slides of the presentation before handing over to Stacey and the team to take you through the rest. And I will try and dip in and out of these webinars over the coming weeks to hear from you as well as you hear from us, because we really want these to be part of a two-way conversation about how we can get better at supporting you in your frontline roles, working with citizens to improve their lives. So if we can go on to the next slide, please, Tracy. Great. So first of all, I'll talk about what is Be Healthy. So Be Healthy, in essence, is 4 pages. Of which there's a kind of introduction page and then 3 pages for action. It's a simple checklist of practical tools and tips to help individuals improve their health and well-being. And these are very much linked to the risk and the evidence base we have about things that increase the risk of either becoming seriously unwell from COVID or dying. And unfortunately, we have lost over 1,500 people in Birmingham to COVID so far. That, I understand, is more than the number of people who were killed in this city during the Blitz bombings. And it's had a disproportionate effect on many of our ethnic communities and many of our more deprived communities. And some of this reflects the disproportionate spread of some of the risk factors that you can do things about, and some of them you can't. So Be Healthy is really focusing on things that each of us can change to reduce our risk in the coming weeks, months, and ultimately years ahead. So if we move on to the next slide. So the aim with Be Healthy is that the resources are there on the website, so anyone can pick them off and download them. But what we really wanted to do was make these practical resources to support leaders and professionals who are working already with communities and have that trusted relationship, to have something that they can use directly. And that's what this webinar series is about. It's about providing additional opportunities for us to share further information, but also for you to ask us questions as we go over the coming days and weeks and months of Be Healthy. So you can help us fill in the gaps where you're being asked questions by clients and you haven't quite got the answer. And there's a range of additional materials that are up on the website as well. And we'll be adding to those over the coming weeks and months as we go through this, as well as sharing good practice. So there's a real opportunity to use Be Healthy to celebrate some of the good work that you're already doing as well. If we go on to the next slide. This is always the joy of web broadcasting, that we're all getting used to the tech. So thank you. So I do want to just start by saying, the approach we've taken is evidence-based. So we've really focused on the things where there is clear evidence, and I'll come on to that a bit, about clear evidence of linking to COVID. We have a significant bit of this which is around just practical tips on what you should be doing to keep yourself COVID safe and your family safe. There's guidance and support about how you manage long-term conditions, which we know increase the risk of becoming severely unwell. There's practical advice about supporting healthy livings. We know from a lot of the evidence that it's very hard to make some of these changes if you try and go on a crash diet, for example. It very, very rarely lasts, and you may get success for a couple of weeks, but eventually you get bored and you go back to your old habits. And often what we see is that people often gain back not just the weight they've lost, but they gain back extra. So it's more about how do you make this practically part of someone's life, and small steps each day really add up to a really seismic change. It's both about doing the good things and also about how do you stop some of the bad things, and recognizing that stopping isn't always easy. And alongside this is a kind of core thread about how many of the things we're asking people to do improve their mental health, some of them very explicitly, and some of them more, the evidence-based shows they have an impact, but we might not say it out front. So if we go on to the next slide. So I just wanted to set out what we know about the risk factors for developing severe disease or death due to coronavirus. So there are basically 3 things that you can't change that increase your risk, and they reflect the 3 things that you can change. So the 3 things you can't change, and I'm sorry to the cosmetics industry, but you can't change your age. One of the things we are seeing is that there is a strong correlation with older age and increased risk of severe illness or death, particularly if you're over 80, but increasingly actually if you're over the age of 60. When we talk about gender, there is a significant difference between men and women. Men are much more likely to be severely unwell or to die from COVID, and that relates to some of the other conditions on the right of your screen. And similarly, there are some ethnic groups, in fact, pretty much every ethnic group that is not white British has an increased risk of severe illness or death. It's differing amounts, how big that difference is in different groups, but most non-white British ethnic groups do have an increased risk. Now, what's sitting behind this is that actually men and non-white ethnic groups tend to have higher rates of long-term conditions. And not just that they have more long-term conditions, they're generally not being as looked after as well. Men are more likely to be obese than women, and men are also more likely to smoke than women. So the 3 things you can do stuff about are more common in men than in women, and some of them are more common in some ethnic communities, and that very much sits behind the gender and ethnicity elements. It's not a genetic thing, it's very much about the existing health inequalities and the health differences that exist. So the 3 things you can change: smoking. Stopping smoking makes a huge difference in terms of the risk of being severely unwell or dying from COVID. Makes sense, it's a respiratory illness predominantly, although it does all sorts of weird and wonderful things to the rest of your body. Obesity is one of the strongest correlations we're seeing coming through now as we get more data from all over the world. Carrying excess weight definitely increases your risk of severe death or disease if you catch COVID. And then the third risk factor, which is these long-term conditions, is really in 2 parts. So first of all, having the condition increases your chances of being very unwell or dying. And then secondly, if that condition is not well managed, then you're more likely to have problems than someone who has a very well managed condition. And if we take the example of type 2 diabetes, someone who's got really good control of their blood sugar, doesn't have any other complications with their eyes or their feet, and they catch COVID, they will have in general a much better run of it than someone who's got very poor control of their sugars and lots of complications. And that's really because their body's not in as strong a position as the person who's well managed. Now, the management of long-term conditions is a bit about how the NHS offers support and a bit about what individuals choose to do. So there are issues on both sides of this that we have to work through. Now, if we move on to the next slide. It is important to just flag that there's lots of other good reasons to do some of the things that we're asking people to do. And there are lots of gains beyond just COVID-19. But we're using the opportunity. COVID-19 is on people's minds at the moment. We aren't going to be out of this for a long time. It's highly unlikely that we will see a vaccine in this calendar year. So I think it's important that we keep that in mind. But actually, simple steps like getting physically active every day has a massive impact across a range of things. And some of these kind of impact on each other. So getting physically active reduces your risk of developing type 2 diabetes by up to 40%. Also, if you have type 2 diabetes and you get physically active every day, then you are much, much more likely to have well-controlled blood sugars, and you're much less likely to end up requiring insulin. So there are other benefits that overlap. Being physically active can reduce your risk of breast cancer if you're a woman. It reduces the risk of colon cancer in both sexes. It reduces the risk of depression. And for people who have depression, getting physically active every day can reduce the need for medication, and in itself can be as effective as some of the first level intervention drugs. So there are some really good examples about actually some of this thing can be really positive for everyone else for a load of other reasons other than COVID-19. But if COVID-19 gets you moving, I'm happy to take it. If we move on to the next slide. The other thing I want to say is this is not about reinventing the wheel. Where there are things that work, let's use them and let's help people connect to them. So there is a website and an app called Germ Defence, for example, which is supported by Public Health England and Department of Health. And it's really a kind of app you go through to think about how do you keep you and your family safe at home from germs. And they've gone through it and they've just tweaked it a little bit for COVID. But it's a really good tool if you're working with a large family, for example, who live in the same house, who are kind of going, this is all very well and good, but I can't keep 2 meters away from granny all the time. We just don't have that space. Then using something like Germ Defence can really help people think through and just have a bit more of a kind of conscious approach to how they're managing germ safety in their own households. We've got the NHS app library. There are a whole load of, in general, free apps that are there that can help all sorts of things from weight loss to sleep management. And then we've got the national campaigns like One You and Change for Life, where there are also resources. So where we can, we'll link you to resources. What we're also doing is looking internationally where there are international resources that are appropriate. We're very conscious that for some of our communities are very connected with communities in other countries, and you're more likely to engage perhaps with an app or a website that's coming from the FSAI in India, for example, which is the equivalent of our Food Standards Agency, than they are perhaps with something coming from the Department of Health, because it speaks much more strongly to their cultural values and their community networks. So where we can find things like that, and if you want to recommend things to us as well, do, because we're really keen to make this as culturally diverse and as culturally appropriate as we can. And we recognise that there isn't a one size fits all, that often people will need to try several different techniques before they find the one that works for them and their lifestyle. So if we move on to the next slide. So this just gives you an overview of the webinars that we've got coming. There are 16 webinars lined up so far, and they're covering a broad range of topics from COVID safety, and we're doing some of those first because, of course, as you're all aware, numbers of cases in Birmingham have picked up a bit. So we're really keen to kind of make sure everyone is on the same page about COVID safety and aligning this all up together. And then we move through things like getting mind ready, through to management of long-term conditions, through to some more specific stuff around unhealthy habits. So as I was saying, we've got a series of webinars lined up. There are 16 in total. You don't have to attend all of them, but we do ask that people book for the webinars, and you can share the recordings, and we will be putting those recordings up online as well. But hopefully these will become quite interactive, so it's an opportunity for you to ask any questions around the particular topic. And what we're trying to do is have experts there to really talk in detail about the topic, and then take questions from you to help answer any questions or concerns you have about having these discussions with clients and with people that you work with. So we hope it will be interactive in that way, and that it will be a real opportunity for us to really strengthen support to citizens through all those day-to-day interactions that we have. So I think at this point, Stacey, I'm going to hand over to you. Is that correct?
Sorry, Justin, I was just admitting people. Yes, that's fine. Thank you for joining us. I understand you're rushing off to another meeting as well.
I am afraid, but thank you. And I'm really, really impressed by everyone who's on the group. I'm really pleased and excited to see how this goes. And I hope to be able to join you at the next one to listen in and to learn from one of the experts we've got coming to talk about behaviour change, who I think is Stuart King, which I think will be really exciting. So speak to you all soon, colleagues, and enjoy the rest of the webinar.
Thank you, Justin. Right, I'm going to be flitting between the slides and just letting people in whilst people are still rejoining, so please bear with me. So as Justin was saying, we've got a whole series of webinars and they're led by experts in the field. So whilst we've got an overview and as Justin explained, an awareness of the things that we can be doing to mitigate against COVID, these people really understand these topics in detail and will be giving far more detail and interaction about the topics. So if you have one that's of particular interest to you or the community that you're trying to reach, then it's really worth joining the specific ones as well. They'll also have some recorded speeches from the experts that you can use with community groups as well, which will all be available post-webinars. Right. So Justin started to touch on the different types of webinars we've got. These ones, the first set are key, so the Keeping COVID Safe. There's 4 kind of different webinars. These are all short, half an hour, and they touch on some of the key things that we can do to prevent the spread of COVID. So the first one is hand washing, and this will be a practical demonstration of how to wash hands, and it'll all be recorded so it can be used. The next one is key, so it's around visiting friends and family, what's safe to do, what's not safe to do, when we should isolate, when we shouldn't. The one around testing we'll look at, and that's led by the nurses that are carrying out testing, so they'll run through exactly what to expect from booking a test to having the test, what it might feel like, and then what to do whilst you're waiting for the results, and what your family members should do as well. So real practical help and advice and guidance that hopefully can help everybody to keep safe. The self-isolation webinar, again, gives details on when you need to self-isolate, how long for, what about people that you've been in contact with, when you might get more information, or what happens when you get a call that tells you you need to self-isolate. So they're really key keeping COVID safe messages. The next ones that we touched on before are the long-term conditions. Monica, are you with me? I'm not sure if Monica's rejoined. I'll carry on. If she jumps in, that's great.
I'm here.
You are.
Hello.
Hello.
I am here, Stacey.
Brilliant. Do you want to run quickly over the long-term conditions slide?
Yeah, sure. So hello, I'm Monica Rozansky, and I also work with Stacey in public health, just in case you haven't heard my introduction at the beginning. In terms of the long-term conditions, disruption of care, diversion of healthcare resources can all impact patients with long-term conditions during national emergencies such as the COVID pandemic, and some long-term conditions may be further exacerbated by increased stress and changes in diet and activity patterns. So the available evidence does not rule out any long-term conditions as not being at risk, but particularly highlights cardiovascular disease, diabetes and kidney disease as being at increased risk of developing a serious illness from COVID. So the webinars we have prepared for you will focus on each of the 3 most risky conditions and provide you with useful advice on how to manage the conditions more effectively, where to find help should it be needed, so that people affected by these conditions are able to cope with any viruses, not just the coronavirus, better, but most of all improve their health and well-being in general. And again, experts in these conditions will be present to provide the advice as well as answer any questions.
Okay, that's great. Thank you. Sorry, I flicked the slide ahead too early. Moving on to unhealthy habits. I think if we just summarise these two, then we can move on to the checklist. So we've got unhealthy habits, and I think Justin probably overran those earlier, and then healthy habits as well. We're now going to move on to the resource. Oh no, we're now going to have a discussion. Or try and have a discussion just about your thoughts about what we've included in the topics for the webinars, whether you think they will be useful to you, if there's anything that we've missed. So if you want to, you can type in the chat if you've got things you want to say, or pop your hand up and come in, and we can have a conversation. So if there's any thoughts on the topics or the webinars or Be Healthy in general, that would be. I've just opened up the chat, so there's some messages from earlier. Good topics, and I've signed up to quite a few. That's great to hear. There definitely will be a lot more detail in the other topics, and it's well worth signing up to them. And thank you for the offer of sharing. Oh, that's great.
Are there any other topics that perhaps are not our list?
Angie, Getting Mind Ready is covering mental health and stress and anxiety. Germ defences. Oh, that's really good to hear that parents have found the germ defence resources really useful. They are great. Yes, we're recording all of the webinars so they can be accessed when it's suitable for people. We realise that maybe everyone is very busy at the moment, and an hour at lunchtime might not be feasible for everybody. Equally, it's not everybody's lunchtime. This one's obviously going to be in 2 parts, but we will try and put it together into one somehow. Yeah, point on culturally relevant resources. We're coming on to that next, and there are definitely some we have available. Oh, that's brilliant to hear that the primary school will be signing up. I think the hand washing will be particularly useful for you, maybe amongst the staff, and all the testing ones too. Webinars translated. We're in 2 minds about this at the moment. We're just trying to work out how we can do it feasibly. It's not ruled out. As Justin said, we want to try and make everything as culturally sensitive as we can and available to as many different people. And obviously that involves different languages. We're acutely aware of that. So we will do as much as we can on that front.
I have just posted a link to the resources and also to the links and posters for each of the webinars on our Birmingham City Council's website. People may find it useful to link through there, but also we will be sharing materials through Twitter and other means as well.
Yeah, and if you have any specific or aware of any specifically culturally diverse resources from within your organisations or groups, then share them, and we will be happy to echo and use as part of this as well. I'm halfway through reading the messages.
There's a message about the BAME communities, and in particularly, is there any assistance specific to the Black Asian community who seem to be affected most by COVID? So there will the tips and advice and issues that will be covered within the webinars will be as inclusive as possible. There might be some specific areas that or specific conditions or specific advice that will be provided to specific ethnic groups, but those are quite general materials. If there are any specific issues that you'd like to have raised within the series or through our resources, then we will be more than happy to respond.
Yeah, I've just seen your second comment, Natalie, about a Black community are 4 times at risk. Yes, we're completely aware of that, and that's so as part of this. That's why we're working through all the community networks. We have different organisations that we're working with that can reach out to these communities, and we're working very closely with the faith leaders as well, with reference to the comment above, to reach out and to spread. And they have trusted groups and organisations that they work with, and we'll be echoing and promoting all of this out through those networks. Okay, I think we should move on to the next bit, but Natalie, I can pick this up with you offline afterwards, if that's okay. I think it'll just be easier. Okay, right, so this is moving on. Hang on, I need to click back on the slide to be able to move it. So this is a checklist and planner. So this is translated into, or will be translated into 18 different languages. I believe 11 are available on our website at the moment. The rest are just in-house, just being done at the moment. It's a 4-page document with an introduction to Be Healthy, a checklist for a healthier you, so key things that you need to look at, or we'd recommend looking at, which link to all of the conditions and the topics of the webinars, and then a planner to help you plan and manage how you move forward, so maybe logging what you've done in terms of these things and where you'd like to go. All of this, like the whole of Be Healthy, is developed from an evidence-based approach. And importantly, at the end of it, it includes the keeping COVID safe details, which will also be translated into the relevant languages as well. So we thought we'd have a closer look at the checklist now. These are available to be downloaded as well from the website in the link that Monica just shared in the chat. So this is the front page, so an overview that we touched on at the beginning of the webinar. So we thought we'd run through this, Monica and I, the checklist for the healthier you, to build up an example of some of the conversations that you might be having around these things. So either with somebody within your community or maybe within your household, just to give an example of how this type of resource can be used. So the first kind of section is get it sorted. So these are things that are important that you make sure you have in place, things that are available to you, free of charge, and there to help and support and improve and maintain our health. So, Monica, are you and your family up to date with vaccinations at the moment?
I believe so, although I'm not quite sure when the flu vaccinations will be available.
Okay, I think they're taking bookings at the moment now. I think you can contact your GP if you're eligible for a free vaccine, and if not, pharmacies are starting to book in appointments as well at the moment, I believe. Have you got children at home? Do they have their vaccinations up to date as well?
Yes, those can be also arranged via schools. So if children are in school, then they can be arranged there.
Okay, that's brilliant. Okay, if you have a long-term chronic disease such as diabetes, have you had your long-term health check? For example, your annual review, maybe with your GP. It might have been online if it's been recently.
I actually suffer from asthma, and I must say I haven't had a check for quite a while, so that's something to be looked into. Certain health checks or long-term conditions checks are not being routinely offered in the same manner as they were before COVID, so it's worth contacting a GP or a nurse and find out how you can go about organising those.
Okay, that's great. So this one relates to a specific age group. So if you're talking to someone outside of this age range, you probably wouldn't want to, you might not mention it, but if you're between 40 and 75 years old, have you had your NHS health check in the last 3 years?
I have sorted it out. Unfortunately, I already classify in this group, so.
I didn't know if you'd want to own up to that.
Oh, for the sake of Be Healthy.
So if you haven't had your health check and you are eligible, then contact your GP to make sure you make the appointment.
They may not be appointments, they may be just the blood tests. In certain areas, they do not actually offer the full check because of, again, the restrictions related to COVID. But yeah, there is alternatives. So
yeah, and your GP will be able to, or the practice manager will be able to support you on where to go with that. So if you're a smoker, have you tried quitting with support from the free local stop smoking service?
I'm not a smoker, so that's not applicable to me.
I'm just going to put a line because I don't think I can write NA with this funny pen. Okay, so you'll notice in the webinar series that one of the webinars is specifically on stopping smoking. There's loads and loads of brilliant free resources out there at the moment that, well, out there anyway, that people can use, and that they really are working, and quit rates are good at the moment during COVID, which is really good to see. Okay, so moving on to COVID safe. So this is more like a few prompts, so to see how your home is and how safe your home is, Monica. So when you get home from activities or being out to the shops, do you wash your hands regularly when you come home?
Yes, I do. 20 seconds with soap and warm water.
Good. While singing happy birthday, I hope. So when you're out and about, do you wear your face covering when you go into enclosed spaces like a bus or maybe the shops?
Yes, I do. I know that people with certain conditions, if this causes them particular difficulty breathing, there are some guidelines around how to use face coverings or where not necessarily use them. So we're referring to that, but we provide it in our materials.
Yeah, no, that's right. So if you were to get COVID-19 symptoms, would you know how to get a test?
Yes.
Okay, so that's a really key one, and one of our COVID safe webinars talks all through that and gives absolutely loads of detail, almost a step-by-step guide of what to do for people. So if you've had a test and you test positive, do you know what you would do next?
Yes, generally I know about the self-isolation of the household, and perhaps arrangements in terms of support that we would require as a self-isolating household.
So do you mean support maybe in terms of maybe contacting friends to ask them to drop food and things off for you?
Absolutely, that's something that may need to be explored.
Yeah, definitely. And then that webinar will just touch on lots of things like that aren't the medical advice, but the other things that you do need in place to be able to self-isolate, the support and possible networks, and maybe worth lining some of these up so you have them in place if you need them, and to work through that with the communities that you can reach. So moving on to some of the kind of the healthy habits, if you like, some of the things that we should be aiming to do. So Monica, do you I feel like I'm putting you on the spot here, but this is the key. Are you getting moderately physical activity for at least 150 minutes a week? And by moderate, I mean enough to feel a bit breathless and feel a bit warm at the same time?
I suppose I do, but I haven't counted the minutes to, exactly. So that's perhaps something I need to start doing.
Okay, that's great. There's a target for you. As part of that activity, one of the or a couple of the exercises a week should be muscle strengthening, so maybe yoga, weightlifting, or maybe body weight exercises like push-ups. Do you manage to incorporate these, or are these some more targets that might need setting?
Probably need more targets setting.
Okay. So moving on to what you eat. So are you eating 5 portions of fruit and vegetables a day?
I would say I do.
Great. So do you manage to avoid full sugar drinks, maybe like especially fizzy drinks?
Yes, I do.
Brilliant. And then I'm glad you're not asking me this one, but are you limiting snacks and sweets to special treats?
Yes, I do. I'm not a snack person, so that's quite easy for me.
That's good. So moving on to the next bit. So this is all about getting your mind ready and helping you to feel mentally prepared. So do you keep in contact with your friends and family regularly?
Yes, but probably prefer if it was more often.
Okay, so I'll put question mark there. So are you volunteering or taking part in any group activities?
Yes, I do.
And say if you were having these conversations with someone in your community, you could then talk about the types of things they're doing and what they're involved with. And then this one's really important. Are you getting at least 7 hours of sleep most nights?
Question mark, I suppose.
Only a little box for a question mark. But no, hopefully that will give you all a bit of an idea of what's included in the checklist for Healthier You and how it relates to the webinars and why we've picked those webinars. The next slide, I don't know if I can I need to get rid of my pen to move slides. There we go. The next slide. Oh, interestingly, it's brought some marks with us. But anyway, the next slide. This is a tool and a resource that people can use. So it runs through the things that we've covered in the checklist. And on this, you can record what you've done. You can also use it to set targets for how many you wanted to do as well, which I think could be a really good way to use it. And then the last page is the Keeping COVID Safe. So it has a paragraph on washing your hands, social distancing, wearing a face covering, self-isolation and getting a COVID test. It also importantly has key websites at the bottom, so the NHS and the gov.uk and the Birmingham coronavirus advice as well. So there's loads more information there, some translated, some not, but they're good places to access more information. As we've already mentioned, this, along with 11 other languages, can be downloaded from the website at the bottom at the moment, the birmingham.gov.uk coronavirus page. And just keep an eye out, more will be added over the next couple of weeks once they're ready. So I've just seen quite a few questions come in. Have you?
Can I just make a plea before we move on to the next
yes, of course you can.
slide and activity? There is a plea that you actually do download those resources in those different languages and in English, in fact, and distribute those amongst the people you're working with, supporting or communicating with. It would be really, really helpful if this starts being used and disseminated even before the webinars conclude.
Yeah, that's right. I'm just picking up on the chat. One of the additional languages is simplified Chinese. Yep, that's one to follow. We're doing our wellbeing visits by telephone and Zoom. Is there an electronic version of this form? I'm just trying to get an electronic version, actually. I was trying to obtain one that we could edit easily for the webinar, so we could have filled that in without the dodgy ticks. So hopefully there will be one to follow shortly. I think it would be really useful to everybody. Yeah, I agree. An online form you could tick would be great. So yeah, just watch this space. We're just trying to get as much ready as we can and trying to push things forward quickly. So some of the resources are just following a little bit. But yeah, I hope that will be ready soon. So we've talked a lot about what is Be Healthy, what's available, and the webinars. So just in addition to the webinars, there's going to be a slide deck to complement each of them, which you can use with some key messaging on. We are generating lots of social media content, so you can follow us at the moment on Facebook, Twitter. We also have a YouTube channel as well, and we're on Instagram too. If you have any questions, you need any ongoing support, or you leave here today and think of a burning question that you haven't asked, if you just drop it by email to the Healthy Brum email address there, we'll make sure that's shared with everybody afterwards. We'll all get back to you as soon as we can, and that could be something as simple as a question or something that you think would really help you, or a different resource or something translated in a different way. Just let us know and we will make sure, we'll do our best to accommodate everything, because we want these messages to be spread and as wide as we possibly can. So onto your role. Whilst we can develop the Be Healthy, we can't reach, we don't have the reach into the communities or the trust that some of your community groups and organisations do. So we're asking all of our partners, some of which are here today, to help us to stop the spread by reaching people in your communities and talking to them, spreading some of these words and promoting what's out there to help them. Hopefully some of this can help to alleviate some fears and also make people feel safer and genuinely stop the spread of COVID. The resources are there, so just please use them. The last thing we would like to do today, before we get on to any more questions at the end, is we're aware there's a massive range of people here today that all have an interest in Be Healthy and are here to find out what's going on. We're hoping that we've reached quite a few people that are based within communities, faith groups, that have roots into communities directly. So what we'd really like to hear from you is, how are you going to spread the Be Healthy messaging? Which community or communities are you hoping to reach? And is there any further support that you would like us to help you with? This is really useful because not only does it help us to work out what's going to happen next with the messaging we're producing, it also helps us to identify if there's any gaps in community groups or organisations that we're not reaching with this messaging. So if there's key groups that we notice from the responses to this are missing, we'll now go back out and work to engage with people from those communities to make sure that we reach as many as possible. So there's two ways we can do this. I thought we could maybe put some of this in the chat, but also if you'd rather, you can email in to Be Healthy for us following the webinar. Does anybody have any thoughts on the pledge or any questions? I can just see the chat flashing, so I'm just opening it.
So there's a point from Maria in terms of the LGBT, Birmingham LGBT working with the council to develop materials which are culturally competent, which is absolutely fantastic.
Yeah, no, it's great. Printed booklets, that's an interesting point. We've had lots of debate about that, and at the moment that it had been decided not to and that they'd be downloaded. But if we do think that would be really useful, we can take that back and see where we can get to with it. Definitely, Natalie.
One of the reasons is also if we start storing and passing on lots of printed materials, obviously doesn't help with controlling the transmission potentially of viruses as well. So if electronic versions can be used, then we'll make sure that those are more interactive, then that would be much better. If there are any issues with accessing the electronic materials, then obviously we will make sure that those are available in other ways.
Yeah, no, that's fine, Natalie, thank you. There isn't a like button I can find on these comments. No. Okay, so hopefully we're going to get lots of pledges emailed to us after the webinar then. We'll make this available as well. Maybe we'll send it around so that it can be typed in the pledge sheet to everybody that's here today. Oh, we've got one here. I think a pledge for us all to go through the questions ourselves is a useful first step. Role modelling and then using in our networks with friends, family and professional capacity to encourage us to take part. Yeah, that's great, Andrew. I know when we looked at this originally within the wellbeing cell within public health, we definitely had a few questions or things that we thought we should possibly change and the way we're operating at the moment. So yeah, I'd say start with yourself is a really good first step. Jazz, did that come into the Healthy Brum email address last week? Other question? Okay, great. That's brilliant. Yeah, I think I thought I'd seen it. That's yeah, no problem at all. And that's anything like that you need advice and guide, just email and we will do our best to get back as quickly as we can.
And also please feel free to download and print those materials if this is, this is the best way to getting those to the communities that are supporting.
Yeah, no, definitely. Okay, so I think the last slide was, there's one really important one really important point on here. So we've covered about the promotion and the sharing, about how you can help. But also, if you spot a COVID compliance issue, so something around social distancing, a way a restaurant's operating, or other things, you can report it using the there's a anonymous COVID form to fill in on the website, and there's also a phone number as well, which is linked there, so you can report things, and things can be investigated and support given to those that maybe need to change how they're operating at the moment. So I'm loving that my ticks and crosses have transferred onto all the slides so far. So I think it's over to the floor now. So are there any questions that people would like answering about what you've heard today, or about the future webinars that are coming up?
There is a suggestion in the chat that we perhaps need a basic what is COVID-19 webinar. There's been a lot of that actually produced by Public Health England. I wonder whether we could plonk a link into the website amongst our resources that covers that.
Yeah, definitely. If there isn't a link already there, we can most definitely do that.
So we will certainly respond to that.
Yeah, and I think your point about COVID and the regular winter flu is probably a tricky one. A lot of the symptoms are similar. I think there is some advice and guidance coming out from PHE, but I think the key at the moment is that if you have the COVID symptoms, you need to follow the procedure for COVID and get a test. And I think that's the way to take it. So until you know otherwise, treat it as COVID. Yeah. Yeah, definitely, Maria.
In terms of the symptoms, because those are really quite varied and wide encompassing, but we do provide information on what are the most common symptoms of COVID. And if any of those occur, frankly, getting a test might be the best way to determine whether this is COVID or not. But there's more information on the Council's coronavirus website, and also links to other resources, and those cover the symptoms and what to do when those occur.
Okay, so I think we're just nearing 1:30. Apologies again for the disturbance in the middle of the webinar. Hopefully we'll avoid that for the future ones. And I think, as we've said a few times, if there is anything else you need or any questions, just contact us afterwards. So thank you very much for your time today, and we look forward to seeing you on the rest of the webinars.
Thank you, everyone.
Thank you.